Today's COVID numbers, we have 2,592 new cases. That is about 100 cases more than this time last week, but significantly less than the 2 weeks before. Again, that is positive, and that we have significantly less virus than 3 weeks ago. And we hope that this will be the first time by the end of this week that we have had 4 straight weeks, 1 month of declining cases. Right now, it looks possible. At the very worst, we think it will be close to what we had last week. Our hospitalization, ICU, and ventilator numbers are all really stable too. One's up 5, one's down 5. But again, we were able to take the steps we needed to at a time when our healthcare capacity could have been overrun, like happened in so many other states. We avoided that, and now we have seen a decrease. Our positivity rate down again to 8.53%. Shows you that this is real. It's not just a result of how many tests there are. We're seeing a decrease in the virus. We only have 106 red counties right now. That's the fewest we've had in a while. We obviously need to decrease that. New cases by county, we're looking at 424 in Jefferson, 152 in Fayette, 134 in Kenton, 117 in Boone, 107 in Davis. For Northern Kentucky, Campbell with 87. Again, watch tomorrow. Help's going to be on the way. But the tough part about our days right now is the number of deaths. January was rough. It was our worst month. And February is going to be tough too. Today we're announcing 51 new deaths related to COVID-19. 7 are individuals 60 years or younger. So today's report includes a 59-year-old woman from Adair, a 63-year-old woman from Ballard, an 85-year-old woman from Bell, a 29-year-old woman from Boone, a 79-year-old man from Boone, 82-year-old woman from Boyle, 93-year-old man from Boyle, 93-year-old man from Breathitt, 2 men from Callaway County, both age 72, 2 men from Campbell County, ages 51 and 82, 87-year-old woman from Carter, 60-year-old man from Casey. Fayette County lost a 75-year-old woman and a 53-year-old man and an 86-year-old man. We lost a 90-year-old woman in Fleming County, a 68 and a 94-year-old man in Franklin County, 53 and a 62-year-old man from Gallatin County, 3 individuals from Hardin, 2 women ages 85 and 88, and a man 81, 89-year-old man from Hart, 2 women from Hopkins County ages 69 and 86. In Jefferson County, 2 women ages 80 and 81, and 3 men ages 80, 96, and 100. 79-year-old woman from Kenton, 77-year-old woman from Laurel, 3 individuals from McCracken, a 54-year-old woman, a 65-year-old man, and a 69-year-old man. A 63-year-old woman from Marshall County and a 77-year-old woman from that county. In Meade County, a 71 and an 80-year-old man. In Mercer County, a 64-year-old woman. In Montgomery, a 53-year-old man. In Nicholas, a 75-year-old man. 90-year-old woman in Ohio, 88-year-old man in Trigg, 93-year-old man in Washington County, 88-year-old man in Wayne, and we lost 2 individuals from Whitley, 87-year-old woman and an 89-year-old man. And a friend of mine lost his father this morning. And messages I've exchanged with him, please remember each of these come with heartbreak, devastating loss. We're experiencing so much of it. So please, let's not surrender now. Let's not do silly things that result in more people like my friend losing their dad, and he's about the 10th individual I know that's lost a parent during this crisis. We claim to be good people. We claim to be people of faith. Let's make sure we live those values and live that faith by protecting each other and not doing the silly things, whether it's here in Frankfort or elsewhere that put people at risk. We are in the bottom 10 in the entire country, which is where we want to be on deaths per capita. Means we've been one of the 10 most successful states about protecting our people. Let's not fumble at this late stage. Let's make sure we continue to do what it takes to protect our people through the end of this virus to the point where we defeat it. Long-term care, if there is a positive in our deaths, which are too high, it's that a smaller and smaller share are long-term care residents. That tells me that our vaccinations are working in protecting our most vulnerable. That also gives me some hope that our numbers are going to change significantly as we move forward. So on active cases, 28 new residents, 15 new staff, 12 new deaths attributable to long-term care. These increases have been significantly less than what we have seen in the past.